Okay, so let's try to talk about Chiari malformation. There are two types of Chiari malformation, type 1 and type 2. Let's start with anatomy. We are talking about the area of the brain, the area of the lower part of the brain, in the area of the foramen magnum. We're talking about herniation. In type 1, there is herniation of the tonsils of the cerebellum, and in type 2 Chiari malformation, not only the tonsils of the cerebellum are herniated, but also the fourth ventricle and the brainstem, they are also herniated. And now the symptoms are as a result of what is happening anatomically. You need to remember that type 1 Chiari malformation is also associated with syringomyel, which is type of a cyst in the spinal cord that can cause compression of the spinal cord, and as a result symptoms related to spinal cord compression like pain, like neurological symptoms, and etc. etc. Now, type 2 Chiari malformation is associated not with syringomyela, but with hydrocephalus and myelomenincocele, which is in the lower part of the spinal cord where the spinal cord is not closed by a vertebra and it can go out and cause again symptoms. There is also something else that is associated with type 1 Chiari malformation, which is tethered of the spinal cord, which is the spinal cord and cord to the spinal column and is stretched, and as a result again neurological symptoms. So Chiari malformation type 1, we are talking about tonsils of the cerebellum which are herniated throughout the foramen magnum. Also syringomyel and tethered spinal cord can occur. From those are the symptoms, which can be CSF obstructions, so you are expecting increased intracranial pressure with vision abnormalities, headache, nausea, vomiting, or vomiting. Let's not talk about nausea. And from the pathology, you can understand the symptoms and signs of Chiari malformation type 1. This is the less severe type 1, and the more common type 1. When we're talking about type 2 Chiari malformation, which is the more severe one, we are talking about herniation. Not only the tonsils of the cerebellum are herniated, but also the brainstem is herniated and the fourth ventricle, and there are again associated conditions with this type 2 Chiari malformation, which is 1, hydrocephalus, and 2, we are talking about a myelomenincocele in the spinal cord when the spinal cord goes out of the back and can cause again neurological symptoms that may be severe. Also, because the brainstem is herniated, especially the tectum is affected of the midbrain, you can also expect that the lower cranial nerves will be damaged. And when we're talking about the low cranial nerve, we're talking about the 12th, the 11th, the 10th cranial nerve, and the 9th cranial nerve. So the 12 is the hypoglossal. It is important for tongue function and taste, if I remember correctly. We have the 11th cranial nerve, which is the accessory nerve, important for moving the shoulders. 10th cranial nerve, which is the vagus. You have ton of functions for the vagus, but one very important one in this area of the head are the recurrent laryngeal nerves, which are important for the larynx functions. So compression of the vagus nerve will cause hoarseness, and it may cause compression or compromise the airway, the upper airway, so it may be even cause laryngeal paralysis that may be a problem for breathing for the patient if it's total. So recurrent laryngeal nerve is damaged and hoarseness. Also the ninth cranial nerve, the glossopharyngeal nerve, is damaged, important for pharynx, for swallowing and everything, and those are the main ones that are affected. So low cranial nerve can be affected in type 2 Chiari malformation, and this is important to remember. So the symptoms of Chiari 2, Chiari malformation type 2, again are based on the pathophysiology and the anatomy. So if there is myelomeningocele cells, so neurological symptoms, especially in the area below the myelomeningocele cell, paralysis of the legs, paralysis of the uh, bladder, and neurological problems below the level of especially the lumbar part. This for myelomeningocele. Hydrocephalus, so you expect symptoms of hydrocephalus and CSF obstruction or obstructive hydrocephalus because of the fourth ventricle that also is herniated, so it's compressed. Lower cranial nerve palsy, as we talked, and tonsil herniation, and what you can see in type 1 myoclonic malformation, Chiari malformation, headache, vision loss or vision problems because of the increased ICP, all the consequences of increased ICP, and type 2 Chiari malformation is more severe than type 1. Now, the main treatment that may be for a symptomatic case is okay, okay, I didn't make a mistake. So the main treatment if the patient is symptomatic, and not, I don't know, asymptomatic, so we are talking about the compression of the suboccipital space in the foramen magnum area, as this is the area from which all the, let's call it, the lower brain is herniated. Which part depends on which type of Chiari malformation we are talking about. As we said before, Chiari 1, tonsil of cerebellum, Chiari 2, talk about the brainstem, tonsil of the cerebellum, and the fourth ventricle, which are herniated. And don't forget all the other conditions that are associated with Chiari 1 and Chiari 2. So this was about Chiari malformation. Thank you very much. You may see this herniation in CT or MRI, and that's it. Thank you very much. This was about Chiari malformations, the two types.